Hello and welcome to my Part D Prescription Drug Plan PDP Part 1 presentation. I'm going to go back real quick, show you a small part in the IRMA video that tells you a little bit about the penalty and who they actually apply to. Part B and D penalty, okay, on your penalties. Well, Bobby, hey, I want to keep my employer plan, but I don't want to get a penalty. The penalties come into play when you're eligible for Medicare, but you don't get on you don't take your Part B, or you don't take a prescription drug plan. What will happen, say you're 67, you keep working, you've got this employer plan. Now when you decide to get on Medicare, get on a drug plan, a red flag's going to go up to Medicare. Okay, and what you're going to have is a form you're able to send in showing, no, I've always had employer coverage, not some little side insurance plan that, you know, pays a little this and pays a little this. It's got to be creditable coverage. Coverage as good as what Medicare would offer you, okay, and most employer plans are going to fulfill that. So you're only going to get a penalty is if you're eligible for Medicare and you have no insurance, you have no drug plan at all. Great. So if that penalty applies to you, let me tell you a little bit about it. So your penalty for your Part D prescription drug plan, your penalty is called LEP, or late enrollment penalty. The penalty is 1% of the national average premium of a PDP plan, prescription drug plan. That national average for 2022 is $33.37. So your penalty would be 33 cents per month. So Bobby, I didn't have a drug plan for about a year and a half. 18 months times 33 cents, $6 a month. That will be added to your Part B premium for life. So if you had a Part B premium, standard premium, $170.10, now it's going to be $176.10 for life. Now for the folks that, Bobby, hey, I always had an employer plan, why am I getting this penalty? Well then, if you got an employer plan, there's a form that you'll send in either whenever you enroll for Medicare, or if you've already enrolled and you're getting the penalty, there's a separate situation. If you're just enrolling for Medicare, you're going to have a form, CMS L564, Employer Proof of RX Coverage. So when you apply for Part B, whether online or with a paper application, not many people going into the offices right now, you're also going to send in this L564 form. Your employer is going to fill that out and it's going to show, hey, I've always had coverage. So at 67, 69, 72, you're just getting on to Medicare, but you've had that employer plan, you're going to send in this L564 form that's going to show them, I've always had coverage, I don't get a penalty. Next, some of the basics on your drug plan. Similar things that are probably on your plan right now. I know they're on my plan right now, and I'm not on a Medicare plan, but on your drug plans, a lot of these same policies are in effect. Pharmacy network, okay, very, very important. Okay, different companies have different preferred pharmacies. You may pay a lot higher price if you're out of network. Okay, so each of these different drug plans, whether it's an Advantage Plan drug plan included, or whether it's a standalone drug plan that you're getting with just straight Medicare, or maybe with straight Medicare and your Medicare supplement. Step therapy. Hey Bobby, I saw this drug on TV, I sent it in, the insurance company doesn't want to pay for it. Well, there's a thing called step therapy. Hey, have you tried any of these less expensive drugs? The doctor says, hey, we've tried those, we need this one. Okay, well then you may get approved for that. But if you're just starting off on the highest priced drug, you haven't checked any of the generics, well, they may require some type of step therapy before they just approve that most expensive drug. Quantity limits. There's some of these drugs you're not getting a 90-day supply. Maybe you're only getting 30, okay? Prior authorization. There's some heavy narcotics out there. Some of these drugs are going to need a prior authorization. Like I said, similar to what may be on your plan right now. Asking for an exception. Bobby, hey, this drug's $100 a month on a tier 4. I can't afford it. Can we ask them if they can move it to a tier 3 for $47 on that plan? Okay, tier exceptions. We do these all the time. Coverage decisions, okay, when we're asking for those tier exceptions, they're giving these coverage decisions in 72 hours. Hey, we need to know, this client needs to get the drug, they can't afford this one, can we get an exception for a lower price drug, a lower price tier on that same drug? And then tiered formulary, okay, on these plans you've got different levels for different drugs. Tier 1, preferred generic. Well Bobby, what's a preferred generic? Per carrier, what their preferred generics are. Generic drugs, Tier 2. Tier 3, preferred name brand. Tier 4, non-preferred drugs. Okay, like I said, this preferred and non-preferred, that's per carrier, what drugs they prefer. What drugs they'll call just generics or a preferred generic. And then Tier 5, specialty drugs. Okay, these are generally some of your very, very expensive drugs. Okay, to give you an idea, okay, on these drug plans, you may have a drug that's a Tier 1 on one plan, and it's a Tier 2 on another. Or it's a Tier 2 here, but it's a Tier 3 over here. So with each of these drugs, there's multiple prices, depending on what plan you're on, depending on what tier it is, depending on the drug. Here's some examples. Atorvastatin, on one plan it's $0, another one it's $1, another one it's $15. Digoxin, $4, $19, $47. Giant spread there. Gabapentin, some plans it's $4, another one $19, another one $30. Merbitric, $47 on a plan. That's a Tier 3 on that plan, $100. It's a Tier 4 on that plan, or $228. That's telling me the drug's not even covered on that plan, that you'll pay full retail. Quetiapine, $20, $42, $61. Bobby, how can that be? Well, these drug companies sit back, okay, and they say, United Healthcare, Aetna, come on in, let's make some deals. Cigna, come on in. We'll buy 100,000 of those for this price. We'll buy 200,000 of those, okay? So it's different on every plan. You may have some plans there it's the same, but what you want to count on is these drugs could be different prices on different plans. And then Tresiba, some plans $35, another plan $47, another plan they don't cover it, $610. You're paying retail price for it. And then you throw mail order in, okay? What we do here is I'm going to take all your drugs and we're going to run every drug through every pharmacy, through every plan. And we're going to come up with the best prices for the year with your drug list, okay? PDP premiums, okay? Some people, well, Bobby, I just want the cheapest plan. No, you don't. Okay, don't start that way. You can get yourself into a lot of trouble that way. You got plans that are under $10. And then you got them $10, $15, $20, $25, $30, $40, $50, $60, $70, $80, up to $100 plus on these different plans. And I've got people in each of these different plans, their specific drug list, their specific situation. Okay, Advantage plans, some plans you've got the Part D included. There's also Advantage plans where there is no Part D in the plan. Okay, Part D deductibles, what you've got to pay before the plan starts paying anything. Some of these plans don't have a deductible at all. Maybe $100, $300, the highest for 2022, $480. And I can tell you a lot of plans had that deductible $480. Like I mentioned again in one of my earlier videos, you may have a plan that has a $0 deductible and that's the best fit, or $480 and that's the best fit. It's not until you run all the drugs that you would ever know that, okay? Then you've got different stages, okay? Medicare drug payment stages. The first stage is the annual deductible stage. Like I said, some people may not even have a deductible. Well, Bobby, I got four or five generics. There's a deductible on my plan, but they're not charging me. Well, maybe that deductible doesn't come in until Tier 2 drugs, or Tier 3, or Tier 4. It's different on every plan. So in that situation, annual deductible, Bobby, I don't have any deductible. All I've got is these generics. Somebody else, maybe they've got one of these drugs that's a $500 retail, and then $50 a month after that, but in the deductible stage, they're paying that $480 deductible, okay? And we're gonna use this 550 number on some of the other presentations as well. So Bobby, hey, I'm paying $500 the first month, but then after that, it's $50 a month. Okay, well, it's a $500 drug. You're paying about retail the first month, then you're paying 10% every month after that. So you've got some great coverage when the insurance company is paying 90% of your drug, okay? Then your initial coverage, Bobby, the deductible's out of the way, now I'm just paying the copays, just like you'd have here. Bobby, I don't know, I'm paying $1 a month. On that drug, Bobby, I'm paying $47 a month, or I'm paying $19 a month, okay? That's after the deductible. You're paying your copay as set out in the literature, or what we would find you online. Coverage gap, okay? At a certain point, when the retail price of your drugs, okay, Bobby, $500 a month, on about 9 months, you'll be at $4,500. Right about that time, when that retail equals about $4,500, you're going to go into the coverage gap, also known as the donut hole, and you're going to pay 25% of retail. My next video is going to get very specific into this. A lot of my clients have this situation. It's hard to explain over the phone. I'm going to have this video out specifically for the coverage gap donut hole that's going to enlighten you on all these numbers and why, Bobby, I'm paying $4 grand a year. That may be really good when you're getting $20,000 worth of drugs for the year. And then your catastrophic coverage, okay? Very few people go into this. I'm going to explain that along with the donut hole coverage, okay? Another thing, there's folks that maybe with the lower income. On the IRMA video, we showed you folks with higher income. Folks with a lower income, they may qualify what's called extra help or low income subsidy, okay? Where now some of these drugs that may be $47, $100, well, they may get these drugs for $5 or $10 because of extra help, low income subsidy. The next level would be Medicaid. Bobby, hey, my mom's got Medicaid, okay? She's going to pay much less, next to nothing, for most of these drugs, okay? In the meantime, like I said, what we will do is people will say, well, Bobby, I want the lowest premium. I want something without the deductible. Hey, I want that lowest price on my atorvastatin. Okay, we don't search it that way. What we're going to do is we're going to put in all your drugs. Okay, we're going to run them, like I said, through every pharmacy, through every plan. What we're looking for is the least amount out of pocket. Drugs, your plan, deductible, the plan premium, everything. Bobby, what's going to be my out-of-pocket max? Because you may start looking, Bobby, I want the plan with zero deductible, and your drugs are $2,000 for the year. Well, this one with a $480 deductible, your drugs total out-of-pocket $1,400 for the year. Okay, so it's very important that you don't go by premium, don't go by Part D, don't go by specific drugs. Find yourself a professional that does it like we do and is going to turn over every stone to make sure when you go in the pharmacy, you're going to know all year every price of every drug at that pharmacy. We'll get into later also some of the coupons. Some of these companies that have these RX coupons, we've got clients been using them for years, saving hundreds and hundreds of dollars every year. We'll get into those in our future videos. Thank you so much for watching. We look forward to seeing you back.
Call 832-788-9888 to set up a free, no-obligation consultation with a Medicare Plan Max agent in your community to see if you qualify for a special enrollment period.